Hello and welcome to another session of the Captain's Table. My name is Dr. Jeff Pelton. I am a small animal veterinarian in Santa Barbara, California. Today I have the pleasure of speaking with Dr. Emily Mangan. Dr. Mangan is the owner and sole practitioner at the Wisewood Integrative Veterinary Medicine up in Eugene, Oregon. She was also an assistant professor at the Chi University in Florida. Dr. Mangan graduated from veterinary school from Oregon State in 2019. She just went on to do two separate internships, one at the Marion DuPont Equine Center and the other at the University of Florida, where she received her certification in different modalities of alternative therapy. We will be discussing those in depth and discussing how alternative and holistic medicine applies to veterinary medicine and for today's animals and today's pets. So welcome to the Captain's Table, Dr. Mangan.
Thank you so much for having me. I'm happy to be here.
Okay, so as we already alluded to, you graduated in 2019 and you are now in Eugene at the Wisewood Integrative Veterinary Medicine clinic. So could you just give us a rundown as to how you found yourself from veterinary graduate to professor and practitioner of integrative medicine?
Absolutely. And it's a funny journey, honestly. You don't always end up where you think you're going to. My experience and my journey with integrative medicine began when I was a kid, honestly. You know, my mom worked for an acupuncturist a long time ago. That was always part of my life, that acupuncture and herbal medicine was something that we could do as medicine. So I always had that foundation. And then when I went to vet school, I always thought that I would incorporate that somehow, but I didn't fully understand what that really meant for me. But when I was a third year vet student, it's a 4-year program. So in my third year, I actually studied acupuncture at the Chi University, along with my other studies, which was kind of a large bite to take. But I'm glad that I did, because I was able to really direct my career from an early standpoint for what I wanted to do. So with that training, you know, I graduated vet school as a certified acupuncturist. And then I went to Marion DuPont Scott Equine Medical Center for my first internship in Virginia. And it was an incredible experience. It's just high caliber, beautiful horses everywhere that you looked. And all these complicated cases that we saw, I just wanted to treat with acupuncture, right? So like the colic that doesn't respond, you know, that is what I wanted to grab for were my acupuncture needles. And so I decided to really lean into that and pursue that further, and applied for a specialty internship at the University of Florida with their integrative medicine department. And that's really where I honed in on all of those skills. And so I went to the University of Florida. I split my time working with horses as well as small animals and exotics. And then I additionally, during that time, completed a few hundred continuing education hours in everything from animal chiropractics to herbal medicine to nutrition and food therapy to massage for animals. There's so many modalities that I was able to study. And it was great to bring them all back to the Pacific Northwest and practice them all here for my patients. So it's been a little bit of a wild journey.
That does sound like a bit of a wild journey. Okay,
I know.
So as we alluded to, and as you and I discussed before the program, there actually is a difference between integrative versus holistic versus complementary, and then the different sort of submodalities in there. And so I think our listeners would very much appreciate a quick rundown as to the differences between these, and also, as we discussed, maybe throwing in a bit of a history lesson with regards to acupuncture and some of the Eastern philosophies on medicine and how they have how veterinary medicine, how it is applied within veterinary medicine, and some history there.
Yeah, I think that's a great idea. And especially nowadays, as these therapies are becoming more commonplace, most everybody has a little bit of experience with something that isn't your straight Western medicine. So it's great to talk about. Alternative medicine, holistic medicine, integrative medicine, and complementary medicine all sort of describe the same facet of modalities. So it's lots of different things that don't fit into the regular, like what we consider regular medicine in the West. So things like blood draws and vaccines and surgery, those are all very Western ideals of how we approach medicine. But there's other ways to do that. So alternative medicine, they're mostly terms that we use to discuss these different modalities. But as a practitioner, I prefer the term integrative because it feels like we're bringing many things together. So I like to use whatever's best for the patient. So if we need massage, we're doing massage. But if we need surgery, we're still going to be doing the surgery, right? Like I don't perform surgeries anymore in my practice, but that's something that we're going to talk about and recommend for patients that require it. And so, something like using the term alternative makes it sound like we're using one or another, or
Okay.
complementary medicine makes it sound like the medicine that we do is only to sort of assist or support Western medicine. But I truly feel that it's its own pillar of medicine that we can use with Western medicine for the best results for patients. So that's why I prefer the term integrative, but it depends on the practitioner and where they train to for what terms that they prefer for the medicine they do.
Right. So from
Yeah.
just from a, kind of context here, I am the typical Western practitioner insofar as I go to work. And as you said, I vaccinate the animals. I do surgery on them and dentals and all of these different things. I don't use, my practice does not use acupuncture, massage, chiropractic, or any of those things. We do have one practice here in town that does do that, but we're not focused on that in any way, shape, or form. So this is going to be great to be able to also explain to the listeners how this other, as you put it, pillar. I mean, it's not, I mean, you're right. Insofar as maybe not even calling it a modality would even be fair. It is a whole specialty, a whole pillar that is available to them for their animals. So so as we discussed, what about a quick history lesson on alternative therapies and veterinary medicine?
Absolutely. The history is pretty fascinating. I'll try to keep it short and sweet. Acupuncture is definitely the most well-known, widely accepted alternative or integrative modality in the West. And acupuncture has been around for thousands of years. And we're fortunate that we have good documentation of acupuncture because the ancient Chinese were great at record keeping. So we do have textbooks that describe acupuncture as a therapy, as well as the location of acupuncture points on the body and the meridians, which are these channels in the body that you use acupuncture points to affect. So we have good data on that. And the system originally evolves from this Taoist worldview of the universe. It's based on observation, which isn't really unlike scientific observation, where you take observation measurements over a long period of time and look for patterns. And what they found in ancient China was that, there's this cycle with the day and the night and birth and death and disease. And with that ability of watching all these cycles, you can make a larger pattern or cycle out of the universe. So as they apply that, to the world, they also apply it to the body and to medicine.
Okay.
And it's kind of fascinating when you take the concepts of yin and yang and these energetic concepts and apply it to the body. Acupuncture is thousands of years, but we really didn't catch on in the West until about 1970 or so, when it was introduced here and became more popular as a treatment for humans. And then as we have more research and as there's more interest in using it for human medicine, so did it advance in veterinary medicine. And now, the fields, both human and veterinary medicine, are widely accepted. Insurance pays for acupuncture, and there's a lot of good, double-blinded, supported research studies to indicate that it's actually a useful modality.
Right.
We've come quite a far ways.
And as we talked earlier, you mentioned that just given the nature of, well, I guess human life and farming, I guess a lot of this, a lot of these early medicines were focused more around working animals, livestock, horses, that kind of thing,
Yes.
rather than the domesticated pets that we have today. And so I would actually, I'm going to quick interject here. I just want to talk about one case specifically that I want to bring up from my own past that did kind of open my eyes a little bit. It was during my own internship. I was at Colorado State University, where I was doing an internship in large animal medicine. We had in one of our stalls a down dairy cow, which had originally come in because she had low calcium, something that we all call milk fever. A lot of people are familiar with that. And she couldn't get up, and then she had been down for so long, her muscles would no longer work. And we were trying everything that we could. We were trying floating her, we were trying suspending her, we were trying to do all these things, different drug cocktails, trying to get her muscles to work. And we were sort of approaching our critical window, which was at a certain point, you just have to kind of call it and say she's never going to get up, when one of the senior students, who I believe at the time was certified, piped in and said, "Would you mind if I tried some acupuncture?" And the clinician was like, "I'll try anything at this point. We just want her to get up." And so she came in, and it was a combination of acupuncture plus some electrical stimulation. She used with what I could only describe now as a TEMS unit, this little handheld thing, which I thought was going to be way too small and not powerful enough to do anything to a 1,500-pound cow. And she did the acupuncture, and she applied the electrical stimulation to some spots on the cow's neck, which I thought was kind of odd. And she left the stall, and 10 minutes later, we went in and we boosted the cow, and I'll be damned if she didn't stand. And we were sitting around looking at each other, completely dumbfounded, that after 3 days of throwing everything that we had at her, from I guess we call from a Western point of view, 10 minutes of acupuncture, this cow was on its feet. And it was just one of the most amazing things that I've ever seen in my life. And it definitely left an impression on me. So that was just my own 2 cents there. So going back to the history, though, one of the things that's always kind of what I've always wondered about is, mapping out the meridians in people. To me, you can get that, you can get a feedback, essentially. Say someone does acupuncture on you, I would imagine you say, yeah, that I feel better. How is it with veterinary medicine? How is it that these meridians and the points specifically were discovered to be effective when you're dealing with an animal that can't give you any feedback?
Yeah, I mean, that's a great question. And I also think that it's important to realize that they actually do give us quite a lot of feedback. What we're looking for isn't necessarily someone going to be like, "Oh, my arm feels better. Oh, my digestion feels better." But if you're listening to your patients, and these owners have such a good connection with their pet that they're able to see differences, and that's what we're looking for over time. So as you treat an animal with these modalities, it's awesome. Like the story you shared with your cow, when you have those quick, quick feedback that you can tell immediately. But sometimes with chronic conditions or really bad diseases, honestly, it can take a long time to see effects, but we are listening to the patients. There's, from a practitioner side of things, I actually look at the tongue of the animal and I feel the pulses of the animal, it can be an interesting thing to explain if you've never had exposure to Chinese medicine. But both of those are windows into the soul by sort of feeling what the body is doing. So you can have an objective measure, which is, what does the tongue look like and how are the pulses feeling? But again, there's that qualitative measure, which is, how is the animal feeling? They'll let you know. You'll have increased appetite. You'll have better sleep patterns. Their hair coat will get sleek and shiny. Like, there's all these other signs we can look for that they're benefiting from treatment.
Wow. Okay. So
Yeah.
I know we just kind of talked very, kind of almost specifically about acupuncture, but let's also, cover briefly the different areas. You were talking about massage, you were talking about nutrition and all that. So if you could kind of briefly touch on, this is obviously going to be some of the services that you specifically offer versus other alternative practitioners, but could you just touch briefly on these other I guess, this is all part and parcel of, say, the services that you provide. So could you talk about the other areas and how they all kind of integrate together?
Absolutely. And you hit it on the head. They do integrate together. It's so rare that I see a patient that only gets one modality, right? Almost everybody needs multiple. But yeah, acupuncture is a big thing. But next up, I would say most of my patients are on some type of herbal medicine. And that's something that also has a lot of good scientific support now, literature and published journal articles that we know that there's active compounds that are in the herbs that do have physical effects in the body. And herbal medicine is interesting in that you can do a lot with very little. It's I kind of like to explain it like aspirin. So aspirin comes from willow bark, and you can take willow bark itself to have an anti-inflammatory pain relieving ability where you make tea out of the willow bark.
Right.
But also you can, isolate it down and you can pull out the acetylsalicylic acid, the specific compound in the willow bark, which has that effect. And you can take that, and we call that aspirin in a little white pill. But that same compound is effective in the willow bark tea. And so thinking about how herbs work, so many medications nowadays are actually based on compounds that we've identified in plants. And so it's not a big stretch to think that we can use these plants and mix them together in certain ways to have these quite profound effects in the body. And there's often very little side effects. So it's really safe for animals that have liver disease or kidney disease where they may not be able to take Western medications. Right. So I do a lot of herbal medicine. Should we go down the list? I got a list.
Yeah. Well, I mean, if you want to just kind of touch on some major ones that, so that again, if some of the people who are listening are like, hey, my dog's got a liver or kidney issue, maybe, and I know from a Western. So here's the thing: I know from a Western perspective. Okay, I have an animal comes in, say a dog comes in who's having GI problems, and we run blood work, and I find either the liver is compromised or the kidney is compromised. My first reaction is usually not like, well, what can I do to help that per se? What it is, my first reaction is what drugs I cannot use. With say obviously the classic one is an animal who comes in who has compromised kidneys. We can't use a lot of the anti-inflammatories if the animal also has, say, a concurrent arthritis or pain somewhere else. We can't use those because the kidneys are already compromised, and that can be very deleterious to the animal. And so whereas I look at it from, okay, the animal has a bad organ, these are things I cannot use, it sounds like you look at it from the point of view of, okay, this same animal has a bad organ, what can I do to help?
I mean, actually, that's a great way to think about it. That's true. Because so much of this is like we have herbs that will help support kidney function, that can help support liver function. So finding the root cause, what I care about as an integrative practitioner isn't necessarily what we can do about it. That's true. But why is it happening? And what can we do to help the root cause of these things? Okay. One of my favorite ways to describe this was actually by a mentor of mine, that he talks about Chinese medicine specifically as like the difference in how like Western med and Chinese med when your house is burglarized. So pretend that you have a house and somebody comes in and steals a bunch of stuff, right? You call the cops. You're like, wow, I just got burglarized. That's terrible. And you call the police, and that's your Western med. And they come in and they take a very detailed account of what happened and what time and what was taken. And they're saying, we're going to go find this burglar and we're going to get your stuff back. Right? You feel cared for.
Okay.
From a Chinese medicine perspective, you call your Chinese doctor instead of the police, and they come in and they look at your window frames and they look at the locks on your door and they go, I wonder how the burglar got in, and I wonder why the burglar chose you. And then you work on those things. So one of them is mitigating once it's already happened, your Western medicine. You have kidney disease, we're going to do something about this, right? Or working with that. Whereas the Chinese medicine is your windows are broken in your house, your door wasn't locked properly. How do we fortify your house to make you not a target and also protect you better? And we're going to fix those things first.
Gotcha.
So it's a different philosophy of medicine,
Right. Okay.
Yeah.
Okay, so then along those lines then, actually a question that just popped up into my head, which we don't have to necessarily get into right away, but maybe we can revisit later in the program, is the role of integrative medicine in a healthy pet.
Yeah,
you
That's one
know,
of my favorite things.
because,
Yeah.
it's like one of the things that, people are, as a side note, like, we've spoken about this at work, which is, when I graduated, I'll date myself. When I graduated veterinary school in 1996, at that time, a 12-year-old cat, a 13-year-old cat, that was an old cat, a 13-year-old dog, that was an old dog, right, at that time. You flash forward now, here we are in 2024, and I am going in and doing routine physicals on 17 and 18-year-old animals, which is just, when you think about it from a life expectancy and a life quality of life point of view, is incredible. I mean, we've essentially increased the lifespan by 50%. And when people ask me about that, I just say, for me, my impression of the whole thing is simply nutrition. I mean, from now, there's been so much work done in nutrition that from the moment that, puppies and kittens, that's what I work on, are around, they're getting this, they have the access to this top line nutrition all the way from development into adulthood and then beyond. And it just lays the groundwork for, a long and healthy life. But obviously along the way, there's problems, there's sickness, illness, injury, that kind of thing. And a lot of what, veterinary medicine, my job is, the majority of it is that when I walk into an exam room, I'm usually not seeing a healthy animal, to be blunt. I mean, most of my day is taken up with sick animals. But and my familiarity with integrative medicine is the same thing. It's like, what do you guys do for arthritis? What do you do for organ health? But it just kind of dawned on me that I don't know a whole lot about what alternative therapies or alternative medicine, whatever, with this modality and its application to the healthy pet and the healthy animal, and what you offer and what can be done. So you mind if we talk about that real quick?
I would love to. Yeah,
Okay.
that's actually near and dear to my soul.
Okay.
Yeah,
So
I
let's
mean,
let's
because
talk about what you can do and what integrative medicine does for the sort of the average, air quote, average healthy animal. What do you guys?
yeah,
So when you go out and talk to owners and deal with the animals, what do you guys look for?
yeah, I mean, we're looking for similar things, right? We're looking for health and wellness and how to support the animal throughout their life, how to prevent illness, how to prevent disease and injury. And honestly, that's the best place for medicine of all types, is preventative medicine. And nutrition is huge for that. That is your foundation of your body, which is the foundation of your wellness. So making sure that there's a good quality nutrition that's specifically tailored to your animal can really improve their quality of life and their longevity. And that's something, every animal is different. Every animal has slightly different needs, and they're in a different environment. So having somebody ensure that what they're getting nutrition wise is perfect for them is going to help our goal, right? It's going to further our goal of helping them live a happier, longer life. And then the other modalities that we have, like chiropractic, like that manipulation that we have, that can help improve how the body is being used. So you're exercising appropriately, using your muscles correctly, and that can help support the body in other ways. And even something like early intervention. I know that not necessarily healthy, but if you consider an animal that comes in that says has hip dysplasia. Hip dysplasia is really common in a lot of the dogs that we see now. And if you see them when they're a puppy and they are recently showing signs, you can actually prescribe therapeutic exercises. So very targeted, specific exercises that work very much like physical therapy in humans. And you can change how they develop their muscles and how they develop their bones to help them have fewer symptoms of that disease as they age. So there's a lot that we can do early on to help them live longer lives. It's just hard to get people to come in the door, right? When you have a healthy animal at
Yeah,
home, come pay me money, That's
exactly.
something that's a
No, yeah, we get
challenge.
that all the time
Yeah,
too.
I know.
So, okay, so we're actually going to take a break real quick. We're one of our commercial breaks for our sponsors, and we'll be back in just a sec to talk more with Dr. Mangan. Hold on just a sec. Hello, welcome back to the Captain's Table. I am here with Dr. Emily Mangan, and we are having a conversation about integrative and holistic complementary medicine in veterinary medicine. We left off talking briefly about the role of integrative medicine with sort of the healthy patient. And Dr. Mangan, I was curious as to how you could maybe break down sort of, again, the role of integrative medicine with regards to sort of more your healthier patient, but maybe in different life stages, and how what integrative medicine can offer with these, air quote, healthy patients.
Yeah, absolutely. A lot of what we do is wellness throughout the ages, and that's from puppies and kittens to young adults, and of course our older geriatric pets. Our white muzzle club. There's a lot that we can do for them, and age is not a disease, right? And so sometimes you can have a healthy animal that's maybe slowing down or having more issues getting upstairs or other mobility issues as they age, and that's something that we can address also with therapeutic exercises. There's a lot that you can do with increasing specific forms of exercise in these older pets, which can also help maintain how they feel. Exercise is important for everybody. For humans who are receiving integrative or acupuncture care, we say do Tai Chi or Qigong or some sort of martial art that moves your body. And for pets, it's hard to ask your dog to go out and go do some poses, right? But we can take them on walks, and we can do specific things with them, asking them to move their bodies in specific ways that can help maintain their health too. So there's a great amount of exercise that we can do with them that is appropriate, for all life stages. And that's something that a practitioner can help decide for you and your pet too.
Well, along those lines, then, I have a question. Are these things that you will also, are there specific things that you have the owners do, to their animals I mean, not just taking your dog for a walk kind of thing, but are there different massages or home exercises, even stretching, that you'll have your owners do, or is that something that you prefer to do almost like a therapist?
Yeah, I mean, it depends. There's some things that I do with the pet when I see them that are maybe more difficult, or I'm watching for more specific things to make sure it's done correctly. But then I pretty much always send home an at-home exercise plan. So it's very similar to physical therapy, where you're given your 3 to 5 exercises that you're going to go home and do every day this week.
Okay.
And I show my owners how to do it, and we teach the pet how to do it, and that's the best way to set them up for success. And the pets love it, right? They usually get treats out of it. So from their perspective, it's quite fun, and it really can have a lasting impact on them.
Great.
Yeah.
Great. Okay. So one of the things that we talked about was, obviously the most people are familiar, probably the most, as you pointed out earlier, they're the most familiar with acupuncture. So I was interested in sort of taking a deeper dive into this with regards to veterinary medicine, because as we discussed, there's the lack of feedback. Well, you talked about there is feedback, but I was kind of more like, let's get a little more specific about this. Let's get a little more let's talk about the science, I guess, behind acupuncture, and how it, and your goals, and how it is, you achieve these things. And you brought up a little while ago that sometimes these things take time, and let's talk about, time. So let's talk about acupuncture, and if you want to even start with the basics, the most basic of definitions with regards to it, and talk about meridians and points and these different things, and just kind of give a brief, an education background to our listeners.
Yeah, absolutely. That's honestly one of the most common questions that I get. People find me or come to me, or they've been referred to me because they have a pet that would benefit, but sometimes they have no idea what acupuncture is. And so it's lovely to, I think, start from the beginning. Acupuncture, by definition, is the insertion of very thin, fine needles into specific locations on the body, which are called acupuncture points or acupoints, for a specific therapeutic effect. Acupuncture is there's sort of 2 ways to describe it. There's this energetic way, which is the Taoist worldview, where you have these meridians that carry energy, that make a big circle in the body, and they flow normally, and any disruption or disharmony in the flow of that energy results in disease. But then there's also the scientific standpoint, which is we know that these meridians do exist. We have not fully characterized them yet, but there are some great research papers that show that they are correlated with where nerves run in the body, as well as where fascia runs in the body, and that they're electrically connected too. So acupuncture points and these meridians that they're on, they have higher conductance and lower impedance compared to surrounding tissue. So you can actually find them with like a little electrical device, just puts a little bit of electricity into the body, and where it's most conductive is a meridian. So there is a scientific support for where they exist. And then you manipulate these points with needles. So you put a small needle in, and you can use your hands. You can do acupressure as well. It doesn't have to be a needle, but a needle is most traditional. And what we know happens is in these very specific areas called acupuncture points, if you put a needle there, you have a release of serotonin and dopamine and all these endogenous opioids in the brain and locally and in your spinal cord. So there's measurable differences that we can see from a scientific standpoint. And that does not occur when you put needles into what's called a sham acupuncture point, which is just somewhere else on the body that isn't an acupuncture point. You don't get those measurable rises. You can also do MRI.
Let me ask real quick. So depending on these points then, I fully understand the fascial aspect of this because, and I think just about any human out there who has experienced any kind of injury with the adhesions and the fascial and the freeing up of fascial tissue and the range of mobility that can come with that.
Yeah.
So, but when you're talking about an animal and you're talking about a needle, I've always wondered, what depth, what kind of depth are we talking? Through the skin, in the skin, to the tissue deep? How deep do you go, or does it matter, or does it change depending on the effect you're looking for?
Yeah, it depends on the acupuncture point. So it depends on the anatomy, where that point is located. So there's some acupuncture points that are really superficial in the body, and they're like in the skin or just below the skin. If you think about the lower limb of a dog, it's pretty much just skin over bone versus like the big hindquarter of a horse. So I will put a 6-inch needle into a big warm blood flank, right? Okay. Whereas I'll put, maybe a half an inch little tiny needle into like a little chihuahua leg, right? Okay. So it depends on the point, depends on the species, how deep it is in the body and what needles we're using to affect those points.
Okay.
Yeah.
And now does it also depend on how would I put this? Is there one set of meridian lines, or are there multiple meridians in a body?
That's a great question. So classically we talk about 12 meridians that are associated with your internal organs. And so they're paired. There's 12. Yeah, they're paired left and right, and they're named after organs. So there's the kidney meridian, the gallbladder meridian, the liver meridian. So there's 12 of those. And then we also classically talk about the extraordinary meridians. We usually talk about the 2 of those, the governing vessel and conception vessel, and they are unpaired, and those run on your dorsal or your ventral midline, whereas all the other meridians are paired between left and right of the body, but they all connect together and make a big circle. So it's kind of fascinating to watch how that works. But yeah, there's 12 classic meridians that we talk about in relation to organs. Yeah.
And then so when you're doing this, and again, comes from I'm not familiar with a lot of this. You talk about that when you stick the needle in, you're getting the release of these neurotransmitters. From an energy point of view, what is it? I've often wondered, is it like clearing away debris and allowing for better transmission of energy, or are you like diverting the energy into a more appropriate meridian, or what specifically are you looking for?
Yeah, and honestly, it depends what's wrong. Depends what's wrong with the transmission system. So if you have a bunch of junk in there, we call that like stagnation, where it's like a river that has a bunch of stuff floating in it and the water can't get through. So in that case, we need to remove the blockage. So we want to clear the stagnation to let the energy flow nicely through. Okay. But sometimes there's not enough energy, so the river is dry. So in those situations, we're tonifying. So we're asking more water to join the river. And in other cases, the river's too full and too fast, and there's excess there. And so we're asking that to calm down. So we're relieving some of the pressure. So the goal is to balance it. Whatever is out of balance, you're just going to slowly and gently return the body back to balance. It wants to be balanced. That's what the body prefers.
Okay,
So it will help you. But
so
yeah.
when you're addressing a patient, do you then? I mean, how do you? Can you walk us through your assessment and decision making process into what you're then going to specifically do for this specific animal?
Yeah, absolutely. So there's a patient in front of you, you look at them before I even touch them, I'm evaluating them. So typically, like if I'm going to see them, I look through the windows before I'm even in the room with them. How they're standing, how they're interacting with their environment, the quality of their hair coat, the quality of their muscle, if they have lameness anywhere. So, the visual exam comes first. And then I look at their tongue, I feel their pulse, I palpate their body everywhere. I'm feeling for heat, I'm feeling for tension, I'm feeling for any changes other than a nice, supple, happy body.
Okay.
And then that all gives me information about what's happening internally for this Chinese medicine system. And then within Chinese medicine, you actually make a diagnosis, and those diagnoses look different from a Western diagnosis, but they give me information about how I go about treating it. So for example, you have a dog that comes in that has really bad arthritis, and they're very cold, and they're very, sort of curled up. They don't want to move. They're painful. That dog, based on the tongue and pulse and everything that we're seeing, would have something called a kidney yang deficiency arthritis. And so there's, like I said, they sound a little silly, these diagnoses from a Western standpoint. But once I know what's going on with that patient, then the acupuncture points I choose, just like any Western med, are going to be to support that. So we know that the kidney element is affected. We know that the yang is affected. So I'm going to choose acupuncture points that support those things. So we're going to support the kidney, we're going to support the yang, and we're going to clear stagnation, which is how we refer to pain for the arthritis. So by using those three diagnostic abilities there, we're going to have a full treatment for that patient so that we can benefit them.
Okay.
Does that make sense?
No, that makes total sense. Now, as a follow-up question, then for people, like when they bring their animals in, and if you have a specific diagnosis, I'm sure this varies across organ systems, but if you have a specific diagnosis and then you outline a specific treatment protocol with regards to acupuncture and some of these other things, how are you going to tell? You're going to tell the owner, look, I need you to do these things, but I'm going to be back in 4 days, a week, a month. What is like when you look at this? Because like when I have somebody, okay, I'll compare it to Western medicine. I come in, dog comes in, not feeling real well. I take some blood. Blood shows me, and I get the blood work back the next day. The blood shows me a very specific organ system is going to be involved. And I'm like, okay, these are the things that we can do. And for something like this, I'll be in contact with the owner. How's he doing? How's the appetite? How's the energy? And then also, but I need you to come back in 3 weeks and we'll draw the blood and we'll do that as a reassess. So what for you, with your patients, how do you handle, what's a typical reassessment, or how do you handle case management?
Yeah, that's a great question. It depends a little bit what's going on. I'm sure just with your patients too, as far as how quickly you want to see them back and how quickly you're looking for changes after treatment. But for me, usually I would like to see them back in about a week's time. And that's to make sure we're going the right direction. And so I look at the tongue, I feel the pulses, and I ensure that the treatment that we're providing is helping that animal. We're going the right direction, right? Okay. And then acupuncture sort of has this loading dose effective where you'd see them about once a week and then sort of once every other week for about 3 to 5 visits as their loading dose. And then you sort of start spacing them out. So maybe 3 weeks or 4 weeks in between therapies. The goal there is to find the least amount of intervention that keeps them happy and healthy. Some dogs have an acute assault of something. You treat them 3 times, they solve it, they're good to go. We don't need to see you again. Some dogs, might have a long-standing chronic condition, and if they get acupuncture every 2 weeks, that keeps it at bay. We don't need any other things. And so that's for that dog, that's what that dog needs. But in general, I usually check back in about a week or two after their first visit. And then we sort of go from there just based on patient response.
Okay. All right. Now, and then in that time, I know we kind of circle back to this. I mean, as we've already mentioned, acupuncture is probably the most common thing that
Yeah.
you do, or that I should say that people are familiar with. But in a typical case, are you employing acupuncture, massage, chiropractic, nutrition? I mean, how many of these things are you bringing to bear to treat this animal?
Again, it depends what's going on, but typically all of them.
Okay.
If I have a patient that comes to me, no matter what's going on, you can always find something that you can help, right? So you have a patient that has arthritis, really common in these older dogs. Of course, we can do acupuncture to help clear that pain and support the underlying reason why they got arthritis to begin with. But then we'll of course talk about diet. We're going to talk about nutraceuticals and supplements and other things that we can do to support the health of the tendon, the health of the muscle, the health of the nerve. We're going to be doing therapeutic exercises because we know that by using those joints and muscles in the best biomechanical way, we're going to support the joint health better. So of course we're going to be doing that. They likely will benefit from manipulation or chiropractic. I've never met a patient that hasn't had at least one manipulation needed, you know?
Right.
Yeah, so I sort of grab a little bit of everything, yeah, for those patients.
Okay. Well, I mean, so then when it comes to some of the, for me, from a practitioner point of view, obviously, and you encounter them too. As you said, there's the dog who comes, you get called out because of the acute insult, whatever that insult is. Okay. But then you also have, well, let's look at, your arthritic dogs or your chronic kidney dogs, that kind of thing.
Yeah.
When you talk to the owner about moving forward, looking ahead, are there like you need to come out every so often to do stuff, because arthritis, as I explain to, my clients all the time, arthritis is a progressive disease. We can make the dog feel great, next week, but that's not necessarily going to help in the long run. But so when you look at some of these more chronic issues, what do you outline for your clients with regards to a wellness program that you're going to be in charge of?
Yeah, I mean, just like any vet, if you have a chronic issue, that means we're going to be chronically managing this.
Okay.
And so there's going to be an expectation that we're going to be involved with a treatment plan and altering and changing that treatment plan as we go based on how the patient's doing, what they need, and typically you nailed it on the head, that as they progress, it's a progressive disease. Many things are. And so over time, they're going to need maybe more intervention. Maybe they're going to need a little bit more or frequent treatment. There's something that's going to be changing for them as we go. But the general goal is to see them as least as possible, honestly, right? If the owners can do something at home, manage it with diet, manage it with supplements and herbs, and that, saves them money, and saves a vet call, if you will, if we can keep them healthy and happy on their own. But yeah, there typically is a level of management that goes in for those chronic things, chronic GI, chronic pain, neurological deficits. I see a lot of patients that have neurodegeneration conditions or something like intervertebral disc disease where they have chronic back pain or, yeah, that type of stuff. And we're pretty much always going to be involved with those patients.
Okay. Well, we're going to take another break real quick, have one more word from our sponsors, and then we'll be back in just a little bit. So hold tight. Hi, and welcome back to the Captain's Table. I am Dr. Pelton, and I'm here with Dr. Mangan. We are discussing integrative, holistic, and complementary medicine in the veterinary world. One of the things that came to me during our break that I wanted to talk to Dr. Mangan about is, as a Western practitioner, we rely a lot. We put a lot of our diagnostic and treatment protocols and successes, like our measuring of success, is on the patient's blood work. And one of the things that I wanted to ask was, in integrative medicine, What role do things like lab work play with integrative practitioners?
Yeah, and that's a great question. And for me, like I rely on lab work too. Like it's supremely helpful for understanding what's going on inside the body and how your therapy is affecting the animal. I don't offer blood work in my practice, and that's mostly because what I do in my practice is fairly unique for this area, and my time is better spent with my specialties or my special interests. But in order to see me, patients have to have a relationship with their primary veterinarian. And so, I highly, highly recommend continuing with your regular Western therapy. So that's your blood work, that's your normal interpretation, that's your Western medications that they're seeing with their regular vet. And then they can work with me to do additional things that we can do to improve the quality of life for that patient. But blood work is definitely something I rely on too. But I like to send that back to their regular vet and help support the relationship between the client, their pet, and their family veterinarian too.
That's great. So as we also discussed at one point, you and I, when we were talking during the break, it is this relationship that a lot of people, or the perceived relationship that a lot of people have with their pets with regards to integrative medicine. And as you explained, and if you could explain to our listeners, basically the definition of the words and how you would prefer to use the word integrative rather than alternative, and how this relationship is not one or the other, I guess, would be
Yeah.
when it comes to the health of the pet.
Yeah, you hit it on the head there. That's why I love the term integrative, is because I do think blood work is important. It is a mainstay. That's how we make treatment decisions, right? There's so much that Western medicine has to offer. It is an incredible depth of information, and we can do excellent things with it. But Eastern medicine and other medicines also offer other viewpoints and other modalities that we can use to improve patient outcomes. And so I like the term integrative because we get to use everything. It integrates all the different things together to have a singular medicine which supports the patient best. And using a term like alternative medicine makes it sound like somebody has to pick. And I think that that's a disservice to patients, because I think that there's so much good that can be done from just utilizing everything that works, and not singling out this or that.
Right.
So that's my own viewpoint. Yeah.
Well, great. So moving on then, one of the things that you briefly touched on a little while ago was, and I think I'd like to get into maybe some really specifics now, because for me, you touched briefly on a condition called IVDD, which is, for us in the know, is intervertebral disc disease. This is one of the most common presentations in my practice that I have when dogs come in who are injured. And what this is anybody who's ever had any human who has a bad back can understand. This is when we start having problems in the spine with regards to discs, and the inflammation or the movement of those discs create a problem and an impingement upon the central nervous system, specifically the spinal cord. And then from there, you get a whole bunch of array of problems that come in. If Dr. Mangan will allow me a couple seconds here. So what typically happens is the inflammation or actually potentially herniation of a disc puts pressure into the cord, which is just a tube of neurons connecting the brain to the rest of the body, then gets essentially pinched, for lack of a better word. When nerves get pinched, that can lead to a tremendous amount of pain, but most specifically, or most typically, what you'll also see is a lack of muscle strength. The way I explain it to my own patients, or not my patients, my clients, is that muscles are stupid. I say muscles are stupid. They only do what the nerves tell them to do, and then if there's no nerve signal coming in, the muscle is just going to go limp and give up. And so when these animals come in, one of the most common things that we see is weakness. They don't have the strength in their legs. Usually it's going to be in the back legs. Sometimes it's on one side of the body or the other, but usually it's the back legs. There can be a tremendous amount of pain, and there can be a variety of neurological deficits. Now, from a Western point of view, we basically have two things that we can use. One, steroids. Steroids to reduce the swelling inside the spinal canal. A lot of people will understand that there are non-steroidal anti-inflammatories. They're your basic anti-inflammatories in veterinary medicine, which is your Medicam, Previcox, Deramax, or Rimadyl. The thing is, these are not strong enough. They cannot cross well the blood-brain barrier and get into the spinal cord in good enough levels to reduce the swelling in the cord. And then as a result, we have to reach for steroids, which will hopefully help reduce the swelling down. And then the only other thing I can offer them is gabapentin, which is also a human drug, which is good for neurological pain and also as an anti-anxiety agent to help calm the dog down. And unfortunately, well, I guess fortunately, I am lucky in that a lot of dogs do respond to that. But unfortunately, if they don't respond to it, either the owner's looking at a very expensive surgery from a Western point of view, a very expensive surgery, or a paralyzed dog. So what my challenge to you, Dr. Mangan, is to say that same patient, the owner calls you and says, this is what I just went and saw Dr. Pelton. This is what he thinks my little boy has. What can you offer these people?
Yeah, that's a great question. And that's so much of what I do now, honestly, because it's such a common ailment that dogs have, especially long back dogs, or, dachshunds are so common for it. But also I've seen it in a lot of other breeds, and some dogs get it lower in the back. There's a lot of different presentations, but there's a lot that we can do. In some situations, surgery really is the only gold standard option to save the function of those legs. So in those situations, that's, based on my exam, I'm like, this is really what we need to do. But other than those, specific situations, or, like you said, surgery is not always something that's financially feasible. It is not cheap. And so there's always more that we can try from the Western perspective. So yes, you can, do your exam and give them your steroids, and then they'll come to me, and I'll do a bunch of acupuncture. Typically we do intensive therapy with electroacupuncture, and which really wakes the nerves up, right? We try to maintain those signaling pathways if we can. And it's also anti-inflammatory, which is, again, important for the nerve health, to decrease pressure on the nerves and the cord as quickly as we can. And then instituting physical therapy exercises really early on, which improve nerve feedback. So there's a lot that we can do to help the body be like, all right, we know this happened to you, but we need to save the nerves that we can and save the strength of the legs that we can. And it's profoundly beneficial. There's a lot of animals that I've seen that have come to me that have been fully paralyzed in all four legs. They've had a neck injury, an acute injury of the neck, and they can't move any of their legs. And, granted, it did take about 3.5 weeks of intensive therapy, but we got them walking again, right? And being able to give independence and life back to a dog that otherwise, honestly, at that point, it was euthanasia or arthritis, and being able to give them back their independence and the function of their legs is honestly magical. It's like the best thing ever. And that's why I love my job so much, is that you can do things that are really hard to do without these therapies.
Wow. That's actually pretty incredible. You briefly mentioned real quick, the anti-inflammatory effects of some of the things that you do. How does, from a physiological point of view, how does acupuncture relieve inflammation?
Yeah, there's a whole bunch of mechanisms that have been elucidated, and they're all working simultaneously. But the sort of boiled down picture is that you put a needle in, and there's a lot of local nerve endings that receive that signal, and they send a signal to the spinal cord. Simultaneously, there's a lot of mast cells and other immune system cells that also live in acupuncture points, and they are activated and do their own little cascade. So there's something called a mast cell, which if you hit it, it actually releases these little granules. And they have a whole bunch of different hormones and little cytokines in there, which are actually pro-inflammatory. But the cool thing is it's so local, right, that you have this tiny little reaction locally, which has a global anti-inflammatory reaction. You also have release of adenosine, and release of histamine. You have all of these little soups that form at each of these acupuncture point locations, and they all work to tone down the inflammation in the body. So there's neuro-mediated, it's endocrine-mediated, it's locally mediated at all these different levels. And so it's Yeah, we have the most scientific support for pain management and anti-inflammatory effects of acupuncture. And it's really cool. You can pop on Google Scholar, type it in, and get some excellent papers on the mechanisms. Yeah.
Wow. Okay. So we're going to take one more break real quick, and then we'll be back in just a second. Hello, and welcome back to the Captain's Table. Again, this is Dr. Pelton talking with Dr. Mangan about integrative veterinary medicine. So, let's talk about one of the things that is also from a practitioner point of view that I've always been interested in when I have people give me feedback who have used acupuncture is as you and I have discussed before, in the classic one, I would say the arthritic dog, my client will tell me that they'll go and get a acupuncture session. The dog will feel absolutely amazing, they said, for 2 weeks, and then it starts to sort of wean off. And my question to you is, when you're dealing with some of these treatments, when you're dealing with some of these disease aspects of, say, arthritis, what would be an expectation for your clients with their pets as far as can they get longer and longer therapies and like how do you explain to them, this is what you can expect?
Yeah, absolutely. I mean, arthritis is something that we see so commonly. And you're right in that you can have immediate effects of acupuncture. Like as soon as you pull your needles out, they can feel so much better. And that usually does last, anywhere from 4 days to 2 weeks for those initial treatment sessions. And there's this loading dose where if you treat every week or every other week for about 3 to 5 sessions, you can actually decrease the sensitivity of the spinal cord to pain. There's this phenomenon called wind-up pain, which is chronic pain makes your spinal cord more sensitive to pain, which is an unfortunate cycle. And if you can break that cycle, you can actually get some pretty long-term benefits. Some of the dogs that I see for arthritis, chronic arthritis, I'll treat them every 6 or 8 weeks now, and they're good that pretty much whole time. Maybe 3 or 4 days before their appointment, they call and they're like, oh, it's starting to slow down again. I think it's ready for another visit. But we can really get it stretched out. And that's twofold. One is that's the pain relief and anti-inflammatory effects of the acupuncture. But also there's this other cycle that happens, which is as you are moving more normally because your body feels better, you're strengthening your joint capsule, your tendon, your ligaments, and your muscle, which support the arthritic joint better. And it nourishes the joint better as the joint goes through more of its normal range of motion. So not only are you improving just the pain, but you're also improving the health of the joint and the health of the surrounding support structures. So over time, you really can get some beneficial effects, but it does take time and effort. It's not like an immediate bam, now we're fixed, but it's definitely not something that has to be done every week for most patients. Although again, totally patient dependent, right?
Okay. Yeah, no, that makes more sense. Well, this has been absolutely educational. Thank you so much for joining us. Once again, I am talking with Dr. Emily Mangan, the owner and practitioner at Wisewood Integrative Veterinary Medicine Clinic in Eugene, Oregon. Do you have, out of curiosity, do you have a webpage?
Yeah, I do. Yeah. www.wisewoodvet.com.
Wisewoodvet.com. Okay. And I'm sure, I know, and just as a background, just for everybody listening, I may be interviewing Emily like she and I have just met a little while ago. In reality, I met this girl when she was in high school. She rode with me when I used to do livestock medicine. I used to live in Oregon. I did livestock and equine medicine. Emily and I met actually when her own horse got sick, and that's how we met. She rode with me for months, years even, and before that, and before I knew it, she was old enough and she got into veterinary medicine, and now I am honored to call her a colleague. So thank you so much. And Emma's gone off and done everything that I thought she would. She's gone off, she started her own business, she's teaching, she's doing everything. So thank you so much for your time, Dr. Mangan. Is there anything else that you would like to say to our listeners?
Well, one, keep an open mind, which if you're listening to this, hopefully you have been. And two, thank you, Dr. Pelton. You know, the flip side of that story, he was a mentor for me, an incredible influence on my decision to join vet med and my passion. And without him, I definitely wouldn't be where I am today. And I think it's going on 16 years
It's
actually
been a
that
long
that
time.
it's been a while. But
Okay.
yeah, I'm very thankful. Thank you all for listening. I hope you learned something new.
Yeah. So for the end take message here, one of the things that and actually as a Western practitioner, I struggle with this myself. This is an integrative therapy. Western and Eastern medicine can be used successfully together to increase the comfort and health of your pets. And try to keep an open mind. Try to have your Western veterinarian keep an open mind, because I do believe some of the things that I've seen in my career that there is very solid basis to what Dr. Mangan and her associates do. And I think in the instance, we're all working towards the same goal, which is make our pets, happy and healthy. I think that we should all keep an open mind. So thank you so much for listening, and thanks again for listening to the Captain's Table. Take care.